This is the Liberty International Network. So right now we're getting ready to engage into part two of our health day. We had a wonderful time at Liberty Temple over 2233 West 79th Street, and we had some good fun out there. We had coronavirus testing, vaccines, good health information. I mean, all kinds of you know very interesting, informative, educational things. So I would like to thank everyone who took part in that. And right now, this is part two of our um, health day. And so this is something that we've been doing annually for probably the last 15 to 17 years. And normally we do it on the third week in June, the weekend of Father's Day, but this week we're doing it a little bit earlier. So we have some special guests. We have a first timer with us. We have Dr. Mary Towers, first of all. And Dr. Mary Towers is currently a member of Enduring Faith Christian Center under the covering and the tutelage of my good friends, Pastor Prophet John and Pastor Elise DeVille. And so she serves as a teacher. She often brings awareness to the subject of mental health in ministry, and that's something that has been a crucial topic during the last several years. Dr. Towers is a licensed clinical social worker and a certified parent educator with over 12 years of experience as a mental health provider to children, adolescents, and their families. She earned a master's degree in social work from Illinois State University in 2003 and a doctorate degree in ministerial counseling from Rama Institute of Theology in 2008, both located in Chicago, Illinois. And in 2013, she completed the infant mental health certification program at Erickson Institute located in Illinois. Dr. Towers has worked in various capacities, providing direct clinical services to at-risk populations. She's worked as a director and a leader within several maternal health and parenting programs, overseeing the delivery of clinical development and psychoeducational services to pregnant and parenting adolescents and their families. She's also provided psychotherapy to vulnerable youth with complex trauma histories. Most of these services were directed towards protecting children from future abuse and neglect, assuring child stability, enhancing the capacity of families to handle problems, and supporting the growth of individual family members' understanding of child development. In addition, Dr. Towers has a history of working with battered women or survivors impacted by domestic violence and was responsible for the delivery of individual and group therapeutic services at a local shelter in Chicago. Dr. Towers is currently working as a program advisor for a leading funder in early childhood education, where she provides technical support to home visiting programs in Illinois. She has a heart for helping others and is dedicated to enhancing delivery of mental health services within the body of Christ. So part of her mission is to empower individuals so these individuals can empower others using both biblical and practical principles. So without further ado, I've known Dr. Towers probably for like the last maybe 7 or 8 years or so. And without further ado, I'd like to introduce Dr. Mary Towers, and you have the floor.
All right. Thank you so much, Prophet Washington. It is such an honor to be here tonight, this afternoon. First, I would like to just start with thanking Liberty Temple, Full Gospel Ministry, for allowing this opportunity to talk about a subject as essential as trauma on today. And so I would like to give honor to the angel of this house, the Honorable Apostle Shirley Lathan. God bless you. And to all of the Liberty guests and those of you who are joining us today, as Prophet Washington has stated, I will be talking today about the comprehensive traumatic effects of COVID-19 or the coronavirus. So you may hear me use both of those terms interchangeably as we go throughout our time for today. So we're going to go ahead and get started with the advancement to the next slide. One more slide up. And so before we get into today's topic, we are talking about trauma. And before you go into the processing and discussion of trauma, it's really important to set the tone, because when we think about the last 18 months approximately roughly 18 months that this pandemic has been impacting not just here in the United States, but across the globe. Some of the things that we will talk about today, we'll be reflecting, it could be triggering. And so there may be information, there may be content, there may be images or just material that may cause you to think about something or have a certain reaction. So when you feel anything that is stirring up, I would like for you to really be mindful and respond to your needs. This is a time where it's really important to take care of yourselves, even in the process. And you may say, well, what does that look like? Or what does that mean? Some of you may be viewing virtually. Some of you may be in an audience together with others watching. And so when I say respond, sometimes you may need to take I call it a video break. Sometimes you may just need to disconnect for a moment. I love the idea of visualizing one of my favorite scriptures when I'm experiencing any type of stress or triggers, and it's casting your cares upon him. And so I really visualize myself standing with the most heaviest weight or problem that I have. And I try to imagine how heavy that is. And I imagine myself casting it to God of Christ, casting those cares upon him. And so that's what I mean. Respond to whatever it is that you're feeling and then release it. We're going to be hopefully doing a lot of releasing today as we're talking about this subject that is very, very important. And I'm just so excited to get right into it. So we're going to start with our agenda with the advancement of the next slide. And we have a few objectives here that we're going to have a steady pace. I'm going to be consistent, but I have a lot of material to cover. So I'll try to keep my pace, but I definitely want to make sure that we get to the end. We're going to go over some historical accounts of the pandemic. We're going to talk a little bit about how the pandemic has impacted us globally. So we'll take a look at that. And then we're going to just pause for a moment to explore trauma. We'll understand a little bit more about how trauma impacts the body, how it has impacted individuals during this process. Then we'll talk a little bit about risk factors and protective factors. We're going to go into self-care. We're going to talk a little bit about self-care. And then we're going to explore a few strategies that really promote healing as we're talking about this topic on today. All right. In our next slide, I thought it was just really important to just pause here for a minute. This is just a review for many, but we often hear pandemic and epidemic interchangeably. And I was listening to a teaching with my pastor the other day, and he just kind of separated the difference. And I think it's important to really understand what the difference is between the pandemic and the epidemic is, because it really speaks to the magnitude of these last 18 months that we've been in, and to really acknowledge just how impactful these last 18 months have been. So pandemics typically arise from an epidemic, okay? And so an epidemic is pretty much when you have an infectious disease that really impacts a specific part of a population, okay? And so it could be a specific part of a community, a specific part of a geographical location. And so this is a epidemic affects a large number of people, but in a specific area. But when you're talking about a pandemic, okay, is like an epidemic on steroids. So this is typically characterized by high prevalence of some type of disease. And in this case, it's the influenza. It's a virus. And so it impacts multiple countries. And so we're not just talking something that's geographically confined to a large number of people, but we're talking about something that expands past our world to impact other nations around us. So this is a global pandemic that has really hit hard. And so as we move forward with the next slide, Uh, this is, we're not going to spend a lot of time here. I've gathered a lot of facts. I am a fact-based person, and I love finding out, and just kind of going down history to kind of see where we've come as a nation to where we are. Sometimes in order to know where you're going, it's sometimes important to really reflect on where you've been. And so this, act of a pandemic is not new to the United Nations, to America, to many countries. There are several historical accounts of pandemics that have occurred in the past. The most popular one is the influenza pandemic of 1918, and many people are familiar with this one. This particular pandemic occurred, and it was caused by the H1N1 virus, and so it was definitely impactful. And in the United States, it was the first to be identified in the military. And I have it here that approximately 500 million people, or about 1/3 of the population, the world's population, became infected with the virus. And in terms of national deaths, there were 50 million worldwide deaths occurring from this 1918 influenza pandemic. Okay, and it's known as the Spanish flu. One of the next pandemics that hit was later on in 1957. This was the H2N2 virus, and so this was pretty much occurring in February of 1956. And so there were a total of 116,000 deaths worldwide. Okay. And then last but not least, right before we got to Corona, let's see, in 1968, there was a pandemic, the H3N2, and there was how many deaths here? 100,000 deaths in the United States. So that brings us to our next slide. So we're talking today, obviously, about this current pandemic, where we have approximately 249 countries, okay, and territories. And so there is a lot of discussion on how many countries that actually exist. The number, it depends on what source you're looking at, but according to the United Nations, we actually have about 197 countries, but according to other sources, we have over 249 countries, and in addition to territories and principalities. So within that, we have at least 213 countries at this time that have been impacted by this pandemic, okay? When we're talking about deaths, it has been devastating, and we all know the numbers, and the numbers continue to grow. They're live numbers that exist according to the CDC, and so the numbers here that you see on your screen may have significantly changed from the time that I actually charted this PowerPoint. But at the time that I looked, according to the statistics, we're here at about, we're over 500,000 in terms of deaths in the United States. So we're near 600,000 deaths, and it's growing. Worldwide, over 3.77 was the last time I checked for worldwide information on the pandemic. So I'm going to pause here. We're going to switch because we want to talk about trauma. So we're going to watch a video that it's only a minute long. And so I would like for you to just take an opportunity to just listen to some of the information that's shared in this video, and it'll help pivot us to our conversation about trauma. Thank you.
What do you think of when you hear the word trauma? You might think of terrible events like violence, abuse, or disaster. When we hear the word trauma, we often think about the cause, but trauma is actually the effect of events like these. Trauma is a wound of the heart and mind that causes deep suffering. It leaves us feeling overwhelmed and disconnected, and it takes a very long time to heal. It hurts every part of us, our relationships, our bodies, our thoughts, and our faith. Often, trauma sends shockwaves through entire families and communities. And because suffering is part of the human experience, we are all vulnerable to trauma. But God is with everyone who suffers. God feels our pain with us, and God wants to help us heal. That is why we have hope. Whenever there is trauma, healing is always possible.
I love that video, and it pretty much summarizes how I see trauma. Is that there is hope, and we're going to get to that hope a little bit towards the end. But I want to spend a little time dissecting trauma a little bit more. And if we could advance to the next slide. There is a standard definition here, according to Webster, regarding trauma. So trauma is typically a response to any distressing event or something that a person experiences as a stressful or life-threatening, event. And so one of the things that is really important, and we're not going to go into in depth about the different types of trauma, but there are single event traumas, and these are incidents where a person perhaps has experienced like a car accident or a sexual assault incident, or maybe they were involved in a natural disaster like a tornado. It's a single event trauma, and that's one type of trauma. Another type of trauma is complex trauma, and this is trauma that comes from exposure over long periods of time, and so it's repeated incidents of trauma. So it's like repeated single incident. So when you're going into multiple accounts of trauma, you go into what's called complex trauma. And so these are situations where like a person is perhaps involved with a domestic violence partner and they've gone through abuse. This is where you have children who have been sexually abused, not as a single incident, but just over periods of time in their life, and it has happened consistently. These are an example of complex trauma is the type of trauma that we see with the community violence, and you have individual families who've experienced multiple traumas or tragic deaths of a loved one, multiple siblings who have died due to gun violence. So this is like multiple traumas, and we put that in a category of complex trauma. Another type of trauma that we've experienced in this pandemic is collective trauma. And collective trauma pretty much affects a specific group of people. It can affect a certain population, or it can affect a society. This is when you have multiple people who have experienced the same life-threatening event. And so when you think about things like Katrina that happened, where you had residents of Louisiana who were impacted. When you think about genocide or like the war in Syria, some of those are some examples of collective trauma. Okay, so there are specific events that have happened that has affected a number of people. And so then you have historical trauma. And when we think about historical trauma, these are traumas that have taken place over generations, and things like slavery, things like the Holocaust. And then there is another interesting type of trauma that we'll get into a little later. I'm just giving you like an overview, have a lot of information. So another thing I would like to just pause for a minute and say, if you have a journal or if you have a notebook, please take some notes and go over this material at a later time. And then even as you're finding yourself thinking about how trauma relates to you personally, make sure you journal and write those things down, okay? I think it's very important. It really helps with processing some of the things that we're talking about. But I'm getting back to the last type of trauma that I was going to just mention to you is called vicarious trauma. And vicarious trauma, when you think about vicarious, it's really kind of like when you are experiencing the feelings of another. It's almost what many of us kind of refer to like as that discernment, when you can really feel what someone else is going through, particularly people that you care about. And so what happens with vicarious trauma is that when someone that you love has experienced a very significant life-threatening event or situation, their pain is sometimes felt by another person. And so you begin to take on some of that emotionality just by being a part of that particular relationship. So in a nutshell, again, we're talking about trauma in general. And so it's just really important to know that trauma typically has an event that has occurred, and that event causes an individual to feel unsafe or threatened. And everybody experiences trauma differently. Some people can experience the same event and not have the same response. And so that's important to know. Trauma is determined by how you are impacted. And so this pandemic, for example, has impacted people differently differently. And so there are varying degrees of how people have this trauma manifested in their lives. We can advance to the next slide. This is a very, I often use this particular analogy when I'm talking about trauma. I think it really puts it in perspective because our bodies are so amazing. And when God built us, we are definitely the epitome of being fearfully and wonderfully made. Trauma triggers a particular mechanism in our system called the fight or flight response. And I know you may have heard of that before, the fight, flight, or freeze response. And pretty much our brain processes information constantly. So we're constantly processing sight. On an everyday basis, we're processing sound. And in an event where we are experiencing intense threat to ourselves, like it's a perceived threat, okay, that system is alerted, okay? So I have this example here. So we're in this virtual platform right now, okay? Some of you may be together in person, but imagine whether you're in your virtual room and a very angry grizzly bear enters that space, okay? What happens is that there is a stimulus that has been reacted into your body because of that threatening situation. Okay, so that's going to automatically kick in your fight, flight, or freeze response. Okay, so you're either want to get ready and you're about to fight this bear, okay, or you're about to jet and run, okay, or you can freeze, And let me say something too, is that these responses are not premeditated. So you can't say, in this case I'm going to run, or in this case I'm going to fight. No, it's an automatic response. Okay, it's your body's automatic physiological response to the threat. So you do what you do in those moments. And so what happens is that when that mechanism is triggered, all types of things happen in your body. Hormones are released, adrenaline is released, cortisol is released, because your body is giving you what it needs to get out of this threatening situation. Okay. Let me just pause one more time here. As humans, we've inherited this fight, flight, or freeze response from our great ancient ancestors, okay? Let me tell you why. When they were in an environment where they felt threatened, like maybe there was a carnivore hungry predator attempting to eat them, what they would do is that system would be activated. So it would help them to be able to escape that threatening situation. Fast forward to today, okay, that was our ancestors. Today, that same mechanism exists on the inside of us, but this time it doesn't have to be a grizzly bear. It could be a pandemic. It could be chronic stress. All of those things activate that response system. And then those hormones are being released in our bodies. And we know from research that constant release of these hormones can cause negative side effects in our bodies. And so this is where we have growing incidents of individuals who have heart disease, or they're developing all of these health complications as it relates to, some of it is related to trauma or chronic stress, and having this alarm system constantly activated. Your body cannot differentiate between a grizzly bear entering a room versus being impacted by a tragedy, a threatening situation. You experience that the same way. It's filtered through that system, regardless if it's a bear or if it's a trauma, regardless if it's a bear or if you're experiencing chronic stress, that system is activated. So we're going to talk a little bit more as we move forward. I get excited about this stuff, and so I spend a lot of time, okay? But I'm going to fast forward a little bit here. Recognizing the signs of trauma, okay? Trauma impacts us differently, okay? We all have a physiological response to trauma, and it could be emotional, it could be a behavioral response, it could be a psychological response. And so during the pandemic, people have had all of these different types of responses to trauma. For example, when I think about emotional trauma, one of the things that I've experienced with working working with different individuals, providing counseling and hearing some of the stories is that emotional trauma can look like excessive worry. It can be fear, it can be sadness, it can be anger, it could be denial, it could be shame. All of these are emotional signs of trauma. It doesn't mean just because you're sad or just because you're angry that you have trauma, but we're talking specifically about signs that are related to trauma. When you think about some of those behavioral responses, this can manifest in the act of aggression. And sometimes when people have experienced a trauma, it's manifested in how they behave. And, sometimes individuals act aggressively. Sometimes individuals are withdrawn. And we can certainly see this. If you think about the last 18 months, now the world has opened up technically as of June 11. And when you think about like some of the observations that you've seen, even in your environment, people to me seem like they have a very short temperament. Their behavior seems different. Now, these are individuals, obviously, that I don't have a benchmark. So I don't know how they acted prior to, these are random individuals. But what happens is that, behavioral, the trauma impacts people differently. And sometimes aggression is a manifestation of trauma. And so people are short tempered. We have people that are trigger happy. Things are different. There was once, a lot of these things happening before, but it just seems like a lot of people are experiencing, to me, some behavioral manifestations of trauma. Okay. Also physiological responses to trauma. Psychological responses to trauma. One of the things that I've highlighted here is hyperarousal. That happens when a person has experienced a trauma and now they're struggling with nightmares. Now they have loss of memory. Maybe it's difficulty concentrating, sleep difficulty. All of these are psychological manifestations, can be psychological manifestations of trauma. Also, when you think about psychological manifestations, you can think about things like depression. That's a result sometimes of trauma, being depressed, anxiety. We have growing rates of individuals who are abusing substances because trauma triggers a lot of these different things, and the impact can be psychological. So we do have growing numbers of individuals who are reporting post-traumatic stress disorder symptoms because of the trauma. Last but not least are physical signs of trauma. And when you think about physical signs, I like to categorize this as somatization, somatic symptoms. These are all symptoms that translate emotional stress into physical symptoms. So emotional stress turned into physical symptoms is what I call somatization. Okay. And when you think about increased heart rates, when you think about heart palpitations, when you think about people who struggle with migraines, and I'm talking about these particular symptoms have no medical indication. So it's not caused by any other foreign thing that's going on medically. It's just, this is sometimes how trauma manifests. You have, nauseation, but it's not because you ate anything. It's just, sometimes that's the physiological response to trauma. So I wanted to intentionally put a reflective activity in here because this is an important moment, I think, for us to begin to think about this past year. And so I'm going to pause for about 30 seconds. And I would like for you to just think about this past year, okay? And I know we're currently in 2021, but I would like for you to think about the previous year as well up until this point. And how has the crisis created by coronavirus impacted you? And remember, you have that journal and you're thinking, you want to put those thoughts on paper. And then also, I want you to think about what signs of trauma have you recognized in yourself or even possibly with other people? So we're going to take about 30 seconds here, and then you could finish this at a later time. All right. When we think about how trauma has impacted individuals across the world, we can advance to our next slide. Um, there are so many different um, factors to consider. And so I have a list here, but this list is certainly not exhaustive. We have so many other experiences that have been related to this pandemic that it's so much to put on one slide. And so individuals have faced great hardship and loss in this pandemic. We all have been touched either directly or indirectly, vicariously through this pandemic. We either ourselves or know someone who've been impacted. And so we've had some individual traumas and we've had some collective traumas. And so the first one here is loss and death. We're going to get into that one a little bit more. Also, hospitalizations. There were a lot of traumatic experiences related to the hospitalizations of individuals who were either patients or survivors. And the whole experience of going into the hospitals during the pandemic was traumatic within itself. Family members could not visit due to the high contagion factor that was in place and the mitigations. And so you had family members who were not able to be with their loved ones during those most critical times. In their process. And even in those final precious moments, individuals were not able to be with their families. And so the hospitalizations have had a very traumatic impact on our society. Also, family and friends. We all ourselves either know someone or know someone who has been impacted. And there's that vicarious trauma that has taken place. And then there have been lack of resources across the board. We all know that there have been times when people have struggled with perhaps getting access to medical appointments for non-COVID related conditions or lack of resources with being able to find proper supplies and materials that they needed to keep themselves safe and healthy. In-person to virtual activities, again, we're going to get into some of these, not all of these, as we move forward, but this whole shift from in-person to virtual, that's been traumatic. So much has been lost with that shift, and we certainly are grateful for virtual opportunities because it has really helped to create the catalyst that was needed to help our careers for some of us and for houses of worship and then even for school. But the impact of having this type of disconnected experience has had a different experience on some versus others. And so that has been a shift to have to go through that process. Headline stress, we're going to get into that a little bit more, but all of the conflicting information that we've received during the pandemic, especially during the earlier parts, there was information being released from government officials saying one thing and then conflicting information by our scientific experts. And so you can look at the news and you can hear one set of instructions regarding, for example, wear a mask, then not wear a mask. And so in a very crucial time in our society where sometimes the news is a reliable source of information, especially in a pandemic where we don't know a lot about this virus. And so you're looking to some source of a credible source to get information. And when you have all of this conflicting information, that creates anxiety, that creates trauma. The quarantine impact, it goes on and on. I'm going to advance to another slide here. One of the things I wanted to really talk a little bit about from that list that you saw before is loss. And there has been some incredible loss as it relates to the pandemic. Death is first and foremost. But before we get into death, I wanted to talk a little bit about some of the other areas of loss that we sometimes don't consider when we're thinking about loss. We sometimes think about death, and which is certainly a loss. But there has been so much loss in the pandemic. pandemic as it relates to relationships, as it relates to marriages. One of the resources that I was looking into, and we've all heard this, is that there has been an increase, for example, in divorce rates, okay? And this is nationally. And so according to one source, there was a 34% increase in the purchase of online divorce forms. Another legal firm, mentioned having a 50% increase in divorce cases during the pandemic. And we know that this is due to multiple factors. People living in close proximity under these circumstances have been stressful. Relationships were pressured. There was financial strain. And so all of these are contributing factors, not to mention the financial struggles that people have had to endure in terms of wage loss, layoffs. I have a stat here. During this pandemic, at the peak of the pandemic, this particular statistic was captured, is that unemployment rates in April of 2020 reached 14.8%. 14.8%. You may say, well, what's the significance of that? Well, the significance of that is that it hasn't been that high since the Great Depression in 1948. And so that's there was a lot of loss in this pandemic, systemic loss. And those are things like school, church, work, having to shift to work in person to virtual. Those were still losses. And then intrapsychic loss is one that is very interesting. It's the death of a dream. And we know that with God, hope is possible in all things, and all things are possible through Christ. But when you're thinking about intrapsychic loss, this refers to perhaps an individual, like maybe in the beginning of the pandemic, before it hit the fans, and they started this great business that was contingent upon, clientele. And then all of a sudden the pandemic hits, businesses are closed or mitigations are put in place that impacts capacity, which means eventually the business is closed. And so there was just death of dreams, a lot of loss in that. And then we know that this next bullet point on here is deaths. And you can see I have a parentheses on that S because it's plural. But first, even with the deaths, over 600,000 deaths, have occurred as a result of this pandemic. That's a lot of loss. That's a lot of mourning. That's a lot of grief, And the thing about this particular grief in this pandemic is that it was stifled because our predictable rhythm of life, we could even mourn in a traditional, healthy way, like we would normally do with certain cultural practices, whether it's funerals, whether it's memorial services. Certain mitigations were put in place where these ceremonies just could not happen. And if they did happen, they happened at risk, where vulnerable populations and families were just put in a very compromising position. And so there was a lot of loss of closure during this pandemic. Mourning could not even, that wasn't even normalized in the pandemic because of the situation that we were in. So lots of loss. And I have here the S because this pandemic was so contagious. And we know that when it came out, that it really not just impacted individuals, entire families were impacted and lost at one time in many cases. And we know that when you have multiple losses, there is a mourning process that you go through with a loss. But when you have multiple complicated loss, is what I refer to it as, and complicated grief, that's multiple losses happening to the degree that you can't even begin to process one loss because of another loss that has happened right behind it. And so the psychological implications of all of that loss is great. So we can really begin to think and see that individuals may be suffering with depression, may be suffering from some form of post-traumatic stress as a result of the experiences that they've had. We can advance to the next slide. Again, this is exactly what I just talked about. You can see here in this photo taken from the Los Angeles Times, a person who was just getting off of the ventilator talking to their child. And, this was the communication of family members, of their loved ones, sometimes even in the final hours. How traumatizing is that? And this is happening all across the world. PTSD is definitely something that I think a lot of mental health professionals are seeing more and more as it relates to this type of trauma. We can advance to the next slide. Also, lack of resources. Again, these pictures here, all of the things that were in the stores were sold out. No cleaning products. People could not find anything that they needed in order to be safe. And so that created a whole nother level of fear and anxiety and stress, just from not being able to have access to what you felt was needed to keep you and your family safe. We can advance to the next slide. Also, in person, we kind of talked about this one already, is that, this whole shift to in person, like I said, it was just very traumatizing, not only for adults, but even our children went through a struggle. And, going from being interactive and engaged with their peers to being at home, doing e-learning or learning online for like some of those college students, some social connections were lost. Children became isolated. And so this was really a struggle. Okay, we can advance to the next slide. Headline stress, we talked about that. We can go ahead and advance to the next slide. I want you to think about this. We won't have a lot of time to stay here for a length of time, but if you've had any experience during this pandemic being isolated, can you think about what that has felt like for you? And begin to talk about those experiences, whether through journaling or perhaps even sharing with someone. And so please keep that in mind. We can move forward. Okay, so we're going to get into what I call here are protective and risk factors, because when I think about risk factors, obviously these are conditions that lower the likelihood of a positive outcome. But when we're trying to increase the possibility of having a healthy mental health journey, and how can we be successful in this process, we're going to look at some protective factors really quickly. Okay, we can go ahead and move forward. These are some protective factors that I think are really important to consider as you're thinking about your own experiences or the experiences of others that you've perhaps worked with or perhaps in ministry. These are things that if you have these things in place, people can be more resilient, okay, in their process of healing and dealing with trauma. One is just being resilient. Our resilience is our ability to bounce back. And so when you have a person that continues to press forward, continue to find it within themselves to keep living, that is a strength. That's something that combined with some of these other factors can really help an individual have some positive outcomes. And these are not very complicated factors here. They're just things to keep in mind as we continue to move forward. This is, again, your ability to bounce back. We can go to the next one. Our social connections are so important. What is the next one? If we can go to the next slide, I'm so sorry. Oh, the knowledge of trauma. One of the ways that we could definitely begin to experience some positive healing moments when dealing with trauma is our ability to be able to implement strategies and to recognize how trauma impacts us. Knowledge is power. And when you know what trauma is and you see it, you are aware of the signs, you're able to address it even within yourself and with someone else. And so this is really important, especially in the body of Christ, or even just with working with individuals. Sometimes knowing what those triggers are, knowing how trauma impacts people behaviorally, we can respond differently. When you see somebody out and they're getting so upset just because the line is not, like if you're in a grocery store and the line is not moving and they're just having an outburst as if someone just did something so tragic to them and they're just so frustrated. All of that behavior manifestation, when we're aware of trauma, we're able to respond differently, right? We're able to respond out of love because we know we should respond out of love already. But sometimes knowing information is power. Okay, I'll move forward. Also, our social connections are so important. The ability to develop positive relationships that help decrease stress and prevent isolation is so important. And so, connecting with that prayer partner, making sure that you're staying in contact with people. These are all protective factors. And many of us have been able to do that during the pandemic, whether virtually, and we've been able to kind of remain successful with keeping those social supports in place. And it's so important to do that on a consistent basis, okay? This is just a question to just think about. What activities can your ministry, community, network adopt to identify knowledge expectations of trauma? There is so much that we could grow and glow from as it relates to trauma. And sometimes having opportunities where we're learning about the signs of trauma, understanding how to work with people with trauma, that's an intervention within itself, okay? We can know how to pray for each other if we know the source of where some of these symptoms are emerging from, okay? Sometimes first natural, then spiritual, okay? Also, you can pursue this through looking at different types of online trainings. This need can be met. We're gonna move forward a little bit. Concrete needs, concrete support in times of need. The only thing I want to say about this particular protective factor is that sometimes we don't like asking for help. And sometimes individuals feel like asking for help is a sign of weakness. It's actually a sign of strength when you're able to reach out and get the support that you or someone else needs. If you need to speak with a counselor, if you need to talk to someone, you need to call someone and say, hey, I'm dealing with this. I just had a thought about this. I just had a situation about a week ago and it made me think about this. Talk about it. Seek your supports. That's a strength. Okay, we can advance to the next one. Social emotional competence. I think this is so important, especially for leaders, because I think that our ability to clearly be able to communicate and recognize our own issues, it helps us to maintain our relationships. If we're not aware of our own emotional, psychological, behavioral, physiological response to trauma, sometimes it's hard to help someone else because we could be simultaneously feeling the same thing and I'm not aware, you're not aware, we just all over the place. But sometimes having that ability to recognize where you are, okay, so that you can know how to get yourself in a place to be in a position to pray or help somebody else, it can be helpful. And even in a position to just help yourself, it starts with it. All right, we can keep going. We're going to move into this self-care. I'm going to say I have an 8-minute activity. I want to fast forward. So this is a self-care definition according to WHO, the World Health Organization. You can take the time. I'm available to give this PowerPoint for those who would like it so that you can go through and maybe have a more in-depth time to kind of go through and process some of this information. We're going to advance to the next slide. These are all just different types of ways that we need to be able to take care of ourselves ongoing, okay? Even if you've been doing this, having an intentionality around these 5 areas, I think is one of the keys that is so important to maintaining a healthy response to trauma, okay? Physical self-care, okay? This is any activities that you deliberately engage in that you actually enjoy, okay? So you want to do things like, let's see, taking a walk or exercising, getting a massage is a physical self-care. Sometimes even getting pedicures and manicures, that's a self-care. So you want to definitely be able to do that in a way to take care of yourself, okay? Also, psychological self-care. This includes activities that you engage in to stimulate your mind. We need to stimulate our mind. We need to be able to read a good book, okay? We need to be able to write a poem if we feel like it. Be expressive. Take care of your psychological health, okay? It's so important. Sometimes going to the museum or learning a new hobby, those are all things that we can do to take care of ourselves psychologically. Emotional self-care, so important. Don't forget about it. The actions we take to connect with our emotions. This is things like journaling, taking a bubble bath is my favorite. Okay. Yes, that's emotional self-care because it just helps you to relax. Meditation, sometimes talking to a counselor, this is emotional self-care. Talking to a Christian therapist is one of the best things a person could do. I remember reaching out and receiving some counseling services at a time because I really needed to focus on my emotional self-care. Every therapist needs a therapist. I've heard a pastor say that every pastor needs a pastor. We need to be able to take care of our emotional health at whatever capacity we need to. Okay, it's so important. Spiritual self-care, it goes without stating here. We have to be able to connect, with someone greater than ourselves. Okay, and when we connect and we engage and we read our scriptures and we, create vision boards and things for ourselves, it's helpful. Okay, I'm going to fast forward a little bit. Let's see. If you guys could take the time to develop a self-care plan, those 5 areas that we talked about, physical self-care, emotional, psychological, all of those things, write a goal, have a goal in mind. If there's an area, some of us, sometimes we're spiritually healthy. I mean, we pray, we read our word, but then our physical self-care lacks. And so create a plan based on like the areas that you really need to focus on and put it in place. We can advance to the next slide. All right. This is where I get excited, okay? Because when we're talking about transforming our minds from this trauma, and I've been hearing these buzzwords about trauma to triumph, in order to transform, what we don't transform will be transmitted, is what I heard a popular psychologist suggest. What we don't transform will be transmitted in our behavior, in our emotions, in our feelings. We will transmit it. Okay, so we have to first begin to transform our minds, and we only do that through the Word of God, right? We can transform that thinking that we have and get it to match the Word of God. And sometimes what we feel and what we think, it doesn't line up with the word. And so we have to shift to make the word work for our psychological health, our mental health, right? That all of those different areas, we have to be transformed. Okay. This is that supernatural intervention that works every time. Okay. Therapeutic intervention in a bottle. And that bottle, we're talking about the Bible. Okay. We can advance to the next slide. I love this, okay, because this is one of the things that I think, to me, this is one of those scriptures that stand out for me. Beloved, I wish above all things that you may prosper and be in health, even as your soul prospereth. The soul encompasses our mind, our will, and our emotions. So God wants us to be healthy, not only physically, but in our mental health. Okay. So he wants us to be able to prosper in these areas. So if we can just apply the word works there. Okay. And we can advance to the next one. So this is one that I would like to definitely have each of you to commit to. Journaling, you may say, well, you got to write it down, write the vision, right? Journaling really, sometimes when you have all of these thoughts in your mind based on your day, when you take the moment to sit down and write about your feelings, write about that experience, you're getting those thoughts out of your mind and onto paper. Journaling is so therapeutic, okay? It helps us to reflect, okay? Also, deep breathing. When you deep breathe and you are at a place where you're properly positioning your diaphragm, okay, to actually be able to inhale and exhale, okay, this works. It helps to calm us down, and it helps to send that oxygen to all of the parts of our brain that we need it to be in, okay, and it helps us to be able to navigate, okay. Sometimes it's like, just breathe. And I know that statement it means something else, but sometimes in our lives, we need to just breathe. We need to take a deep breath. Also, there's a 5, 4, 3, 2, 1 exercise that I wanted to take us through. And I'll pick the one. I think I'm going to take us through this deep breathing, okay? Because this is one that I definitely want to do. I would like for you, I have about 4 minutes left here, okay? And I would like for you to just, if you could, we're going to calm it all the way down. Okay. We're going to calm down. I want you to lower your gaze. Sometimes people don't like to close their eyes. I heard one pastor say you got to always watch as well as pray. Okay, so they keep their eyes open. But I want you, if you feel comfortable closing your eyes, do so. Okay, but I want you to just slow your pace, lower your gaze. Okay, and I want you to begin to concentrate on your breathing. Okay, concentrate on your breathing. Relax. Sometimes you can hear the rain outside. I don't know what's in your environment. But now I want you to slowly inhale through your nose, by the way. Now exhale. Now this time, I want you to repeat silently in your mind after me while you're inhaling, okay? So I'm going to say it, but you just repeat it mentally. I'm God's, inhale. Beloved child, exhale. I want you to inhale after I finish saying, and when I stop, you inhale and repeat after me mentally. Nothing can separate me from God, from the love of God. That's just one example of how we can actually begin to meditate and breathe and pray. Sometimes even as we're praying in the mornings or whenever your time of prayer, sometimes just pausing to breathe in God's word, breathe in the ruach of God into your life, okay? Breathe in, God, where I'm weak, you're strong. God, you are my provider. God, you are my healer. And just breathe in. Make an intentional effort to breathe in the word and exhale, okay? And when you think about those problems that you have, those traumas, when they come to your mind, say, I'm going to breathe in the ruach of God. And when I release this, hey, I'm casting those cares, hallelujah, onto you, Father God. And you release that thing. Also, we're going to end with the daily affirmations. Affirmations are so important. And I think that sometimes when you're in, your private space or you're, sometimes just looking in the mirror, sometimes affirmation, look at yourself. Okay. Sometimes you got to encourage yourself. But these affirmations are so powerful. There is power in the word, right? It's already powerful. And you say that to yourself. Okay, you begin to decree the word of God when you begin to say, hey, I have the mind of Christ. I have the mind of Christ. You have the mind of Christ. Mine, you got to come subject to the word of God. Bringing, casting down every imagination, every thought into the obedience. We got to just begin to affirm that thing, right? When you do that, it really does help to set your tone for the day. It helps to get your thoughts, your emotions in place. And so we're going to advance to the next slide here. Sorry, I spent a little bit. These are some resources. And again, we're going to actually, I can share, like I said, these slides at a later time. For those who are interested, I'll share my email address. But, if you are in a place where you've been impacted by trauma, and you feel like you need to talk to someone, reach out, get help. It's okay. Okay, first natural, then spiritual. Sometimes when people have lost someone tragically and they've gone through so many things, it's not that they got it. It's a diabolical issue, a demonic issue. It's a human issue. It's an issue that they have to deal with. It's a real experience that they need to process. And so reaching out for help is so important. I have these numbers listed here. If we can advance to the next slide. He can't hardly see those. This is my information here. If you would like to have more information, you have any questions, it has been such an honor and a pleasure to be before you today. I really appreciate you taking the time out to listen to this presentation on the comprehensive impact that trauma has had on us as it relates to COVID-19. And I'll turn you back into the hands of the host.
Go ahead and unmute.
Okay, I think you can hear me now. Okay, so all of you at home, to give Dr. Towers a very huge round of applause. That was an excellent presentation. And if you came in at the tail end of it, or if you came in late and didn't write it, and you missed the onset of it, you can go back when this presentation, this entire program is over with, and you can go back on our Liberty International Network broadcast, and you can view it and watch it in its entirety. I think that was excellent. Trauma is a very important topic, and you're going to hear more and more about this, particularly in the body of Christ, where sometimes we kind of look at things such as trauma and mental abuse, different types of psychosis and neurosis. We view them as taboo, pretty much the same way as we did with HIV and AIDS and other types of things. So we have right before we bring on Dr. Hill, we have a young lady that I met today. I did talk to her boss on several occasions. This is LaShawn Brister from Addis Home Care, and I thought it was important that we do this brief commercial, as I call it, because Addis Home Care offers some great different types of services that I think we need, particularly their cleaning services. And I'm going to let her tell you more about that. But I thought that was particularly interesting in the wake of the coronavirus, and things are opening up again. Churches are opening up. So without further ado, I'm going to introduce Ms. LaShawn Brister, whom I met today from Addis Home Care.
Hello, everyone, and I want to thank you for having me. I am here representing Addis Home Care. My name is LaShawn Brister, and I am the Community Outreach Coordinator Manager as well as the Deep Cleaning Manager. We are a national home care agency. We provide in-home home care services for our seniors. We service the Chicago area as well as the Chicagoland area. We are currently hiring for home care aides. On Thursday, June 17, 2021, from 10 a.m. to 3 p.m., we are holding a hiring event at our 95th Street office. The address is 2335 West 95th Street, Chicago, Illinois, 60643. It will be held in the back parking lot of Addis, where we're hiring on the spot. The position we are hiring for is home care aide. This position offers a starting salary of $14 an hour, and on July 1st, it will go up to $15 an hour. It also offers health insurance, sick pay, holiday pay, as well as vacation pay. Again, this hiring event will take place on June 17th at 2335 West 95th Street in the back parking lot of Addis Home Care from 10 a.m. to 3 p.m. And again, we are hiring on the spot, so please come out and join us. In addition to Addis providing in-home home care service, we also offer an additional extra value services of deep cleaning services for our seniors. We provide these services to help our seniors to continue to live in their homes in a clean and healthy environment. Sometimes after going through life changes, some find it hard to maintain cleaning chores. This is where we come in and help them with their homes and unit to get their units back into a healthy place or familiar place. In addition, there is no cost to seniors for this service if they are already Medicare, Medicaid, approval through CCU or MCO funded program. But we also do private pay clients as well, such as homeowners, landlords, churches, as the pastor mentioned, as well as daycare centers. With our deep cleaning, what we do is we come out, we'll do a deep cleaning. We don't do surface cleaning, we're doing a deep cleaning. We're really getting in there, we're getting everything done for you. We're also doing, due to COVID, we're also doing a COVID spraying and cleaning, disinfecting, and sanitizing as well. And that goes for the homes, the churches, and the daycare centers. I want to thank you for having me, because I don't know how long I have, Pastor. I'm sorry, but I want to thank you for having me. If you have any questions about any of the information that I've spoken about, please feel free to call me, LaShawn Brister, or my boss, LaShawn James, at 773-396-5600. And again, thank you for allowing me to speak, and I want everyone to have a cool, safe evening. Thank you.
Well, thank you. Thank you, Ms. Brewster. And so now we're coming to the culmination of our program. We're going to bring up Dr. Hill. And before she comes on, I want to just read her bio. And so Dr. Shirley Hill, many of you know, she's a natural food hygienist. And she earned her certification with honors as a nutrition specialist and educator from Ashworth College in Atlanta, Georgia. So additionally, she holds a PhD in food chemistry as the wellness administrator for the Seiko Global Nation and Seiko Community Development. She has been sent all over the United States to care for many leaders, and she is affectionately called the Apostle of Nutrition. Dr. Hill effectively uses food as medicine, even in the most extreme cases. She has researched, written, and edited The Role of Ministry in Disease Prevention, The Mingled Seed, and The New Face on Child Care. She's also developed curriculum for the Ford Motor Company Daycare Provider Training Program and more. Dr. Hill was a regular guest on TVN's National Doctor to Doctor TV show, Mind, Body, and Soul, monthly wellness program with Annette Harris, as well as Ask Dr. Ron radio broadcast. She's also taught the Eat to Live nutrition course at Chicago State University and Nutrition's God's Way classes at Trinity Inductive Bible Study College. It was Dr. Hill's pleasure to assist four-time heavyweight champion of the world, Evander Holyfield, back to health and school officials in Marmalade, Haiti, to keep more than 200 children safe from disease during the cholera outbreak. In addition to consulting with the Kenneth Fowler of Freeport, Grand Bahamas, to bring a cancer prevention initiative to that country. Dr. Hill is also founder of the National Association of Christian Caregivers and a visiting professor at Seiko Bible College and Seminary. Her dedication to the health and well-being of others earned Dr. Hill the Black Essence Award in 2010 and the Lady of Distinction Award in 2018. Dr. Hill is also a member of the following associations: the American Cancer Society of Illinois, the American Diabetes Association, the Action for Healthy Kids Connection, Organic Consumers Association, and the Association for Christian Caregivers. And she's also somebody that's been keeping me more healthy by, when I call her and ask about certain things, you can keep me away from that microwave and some of the things I have been eating in the past. So without further ado, I want to introduce Dr. Shirley Hill. She's all what I said: philanthropist, author, spiritual Power Ranger, and a great friend of the ministry. Dr. Hill, it's all yours.
First, let me apologize to your audience for that long, unnecessarily long bio. I do apologize.
I had to put it out there. These people don't know who you are, especially about the spiritual Power Ranger. They don't know that about you. Not wearing your costume today.
So thank you so much for inviting me back this year. And I know you asked me to talk about the coronavirus. And so let's do a general, just do a general, what you can do at home. Most of us think that we are powerless that we are powerless against this virus, but we are not. And we are not because we have on the inside of us, God designed this physical body with an immune system. And that immune system has the power that that is your Power Ranger. Your immune system has been designed to seek out and destroy anything that is not yourself, that does not have your DNA. And so I found it very interesting in the beginning when we encountered this virus, that we were being told that no one had an immunity, that no one had an immunity to this virus it was because it was new, and that people had not encountered it before. And then as we went on, we found that there were those people that did have an immunity. And in further research, they realized that we had encountered this virus, I believe it was in 1989, and it was in the form, it was a family member. It was a family member. And so something that we are not aware of is that these viruses and so forth and so on, that they are families. They are families. And that's not a bad thing. That's a very good thing. Because your immune system, if you ever encounter and have a bout with one of the family members, it can be 40 years later, like it is now, since we have encountered this virus. And your immune system, because it seeks out, apprehends, and then destroys anything that doesn't have your DNA, anything that is not self. It does not only destroy it, and that is the end of it, but it codes that DNA. And so in your body, you have its own forensic system. You have all of these things because that immune system, it codes that DNA. Your natural killer T cell, which we're familiar with, that natural killer T cell, I call it Rambo, that destroys, totally annihilates anything that it should not be in that body, anything that would harm you. And so one of the things that we are not aware of, may not be aware of, is that natural killer T cell, once it destroys that entity, like it did in 1989 with this coronavirus, which was then a code, once it destroys that entity, then that natural killer T cell, it becomes let me call it the right thing. It goes to sleep. It lies dormant. And with the code of that virus in its possession. And so it has been turned off by the suppressor T cell, shuts Rambo down so that it doesn't destroy all of the good bacteria that is in your gut and in your immune system that you need. So the suppressor T cell, it shuts that natural killer T cell down. And when it shuts it down, it goes to sleep. But encapsulated in it is the DNA of that virus that it just had a bout with. And so then it lies dormant, it lies quiet until this particular natural killer T cell. So you have others, that's not the only one you have. It lies dormant until that DNA shows up again, until you come in contact with that DNA again. And so it is those people that had a fight about with this virus way back in the 80s. and they encountered it. They had their cold, they got over their cold, and they went on about their life. But that DNA was coded. It was coded in that immune system. And so when here we are, somewhere around 40 years later, and now we're in a pandemic, and the virus that we are fighting, that we're in combat with, that virus is in the family of that same coronavirus that we came in contact with way back there in the 80s. And so then, lo and behold, we suddenly find out that there are people that have a natural immunity. They have a natural immunity to this virus because that when they contacted it, when they came in contact with it back in the 80s, their immune system did what God made it to do. It did what God made it to do, and it gave it its long-term immunity. And that long-term immunity, it lasted for, again, I say over 40 years. And so then those people, their Rambo, their natural killer T cell, it was when it came in contact with that family, that DNA in that family, it came alive. It maybe those people, I'm guessing, maybe they had a runny nose, maybe they had a sore throat, maybe they got a headache, but I promise you, they had a natural immunity. They did not come down with the sickness. They did not have the upper respiratory infections. They did not have the cytokine storm. They did not have all of these things that even lead to death. They did not have it because their immunity had functioned and operated in the manner that God had made it to function and operate. And God didn't, he put it in every one of us. That's the way he made it. When God breathed into us the breath of life, everything that was in him, everything that would keep that pertains to health, everything that pertains to health was in that breath to keep us alive and keep us healthy until we accomplish the assignment that God has given us. Okay. So why is it not operating? Why is it not functioning? First, let me tell you this. We are overcome. We have had millions of people die from this virus. And it is because of one thing. It is because of one thing. And had we known this, we could have saved many people alive. And it's not something that's unknown. It was just something that was not revealed. And so those white blood cells that seek out to destroy, those white blood cells that are produced in the bone marrow, those white blood cells, they war against anything that comes in your body, and they win. They even give their lives that you may live. And so then let me give you an example. If you catch the virus, it is because your low white blood cell count is low. And it will progress. It will progress even further as your white blood cell count gets lower and lower. And so then I'm sorry, something just caught my attention. Your white blood cell count is the key. It is the key because the cytokine storm is that army of white blood cells trying to come to your rescue. There is your immune system trying to come to your rescue. And if your white blood cell count is not viable enough, you don't have enough, then that storm is going to wipe them out. And once when you go into that cytokine storm, that is a sign that your white blood cell count is fairly depleted, and that's when you end up on the ventilator, and then you go through all of the serious manifestations that you go through, and maybe even into death. And that is because of one thing, that you did not have enough white blood cells to begin and finish the job of keeping you alive. Now, there is the white blood cell count is even, it is even involved in that when you, those that get the vaccine. All right, that we have had some people that have even succumbed and died after they have received the vaccine. And that is because the vaccine, remember that the vaccine, it has to have enough of the virus or viral particles in it to activate the immune system, to activate the immune system. And so then, if you don't have enough white blood cells for that fight with that immune system being activated, then the lower that white blood cell count drops below 50 and even lower, and sometimes down to zero. That is why you lose your life when you take when you get vaccinated. And so then, what is it that we can do to keep our white blood cell count up? You all excuse me. I see myself shining and perspiring, and that is because I have quite a few lights on, and so it's hot in here. But so what can you do? One of the things that destroys the white blood cell count is preparing food in the microwave. When you prepare your food in the microwave foods, it is the chemistry of that food is changed in such a manner that it destroys the white blood cells. Microwave food and cooking destroys the white blood cells. And so then you can see that we are beginning to be in trouble if you are a person that uses that microwave to cook, to heat coffee or heat water, and God forbid to heat baby bottles. Then you are destroying your white blood cells. You are reducing your white blood cell count. And another thing that reduces that white blood cell count is sugar. Sugar or enriched flour that turns to sugar. And so sugar, those of you that have been here before, you follow me, you've heard me say this over and over and over again. Just 1 teaspoon of sugar can reduce your immune system's effectiveness for up to 70 minutes. And so then let's take a look at something. You drank a can of soda. You drink a can of soda or a can of pop, we call it different things, for lunch. And in that can of soda, there was approximately 16 teaspoons of sugar. And so you left whatever that facility was where you drank that can of pop, and you had those 16 teaspoons of sugar. And now you've got to go back to your office, or you've got to go home. And we just pray that you don't encounter anyone that has that virus, anyone that just got their vaccine, because they will be shedding viral particles for up to 14 days. And those viral particles that will make them a carrier. And so anyone that is a high risk factor, or anyone that is at risk, that comes in contact with them, they could be, they could be infected. And so you need to protect your white blood cells. You need to remove, we need to remove those things in out of our diet that will weaken that immune system. God has given us an immune system that will protect us from any and all invaders. But if we destroy our own immune system, then we have nothing for protection. And then that's why we have to go to outside means, use outside means in order to try to protect ourselves. Now, how is your immune system made? God made your immune system to be, your immune system is non-specific. What does that mean? That means that it's like the policemen are supposed to be. It's like the police officers that are supposed to be in your neighborhood. They're looking for criminals. They're looking for the criminals in your neighborhood. And it doesn't matter what color the criminal is. It doesn't matter how old the criminal is. It doesn't matter if they're committing their favorite crime, that crime that they wink at, and they say, go on about your way. The non-specific immune system arrests everything that doesn't have your DNA. It arrests them. It takes a bite out of crime by taking a bite out of that entity, taking that bite back to the laboratory, running tests on that. So we would be more familiar with it being called the biopsy. So then your body has the ability to run its own test on biopsy, lab test on or biopsy, to identify the DNA of that entity. If it's not your DNA, oh, they're going down. They gotta die. Because that's the way God made your immune system. And so then, and then again, that DNA is coded. And it does not matter whether it's the uncle, whether it's the cousin, whether it's the brother. You know, if you like, I like to watch these forensic things. And if they have to go back and dig up a body that has been in the ground for 20 years to find out if they committed this crime, or if it was a family member instead of them, they do what they have to do. And that's how God made your immune system. Your immune system, it doesn't matter. All that entity has to have is be absent. Your DNA to be absent. And then because that entity has no business being in your body, your immune system is going to take care of it. And so why am I saying that? Because it's 40 years later. And this coronavirus is most certainly not that coronavirus that was around in the 80s. It has mutated, and mutated some more, and is still mutating. But your immune system had the ability to be non-specific. And so then, if you watch these shows, you see that they say, okay, there are these many matches in this genome. And so that means that they are 90% or 90, they all, they're all in this family, and one of them did it. And they should not, and we will have to apprehend them and take care of that. And so that is what your body does. And so you may get the sniffles the second time that you come in contact with this entity. You may get a headache, but you are not infected. You are not infected because Rambo is aroused, and Rambo takes care of that entity. Now, that is because your immune system, your white blood cells, they are non-specific. Anything that should not be in your body, they're going to handle it. But if that immune system is switched to specific, then that means that it only identifies that entity that the immune system has been switched to identify. And so that's just like the police officers in your community. It's like you got a call. They got a call over the speaker, whatever it is that they get their call over, and they were saying, okay, the perpetrator has is wearing long braids. The perpetrator is a black male. The perpetrator had on blue jeans, and the perpetrator had on a white shirt and he had a short sleeve shirt, and he had tats all over his arms. He was tattooed, as the kids say, he was tattooed up. And so now the police officers, they got the call, they got the mug, the information, and they have it in their brain. So now this perpetrator goes home or goes somewhere, cuts all the braids off, picks that hair out real nice, puts a suit on, takes off, covers up those tats, puts a tie on, and comes out looking like an altogether different person. And the police are around. They're searching everywhere. Guess who's going to walk by the police, and the police are not even going to pay him any attention? They're not going to pay him any attention because they are specifically looking for this entity. And so when your immune system is switched from non-specific to specific, then your immune system is only going to identify that entity that it has been changed to its specificity. And so then all of the other perpetrators, even all of the other black men, or let me change that, all the other male criminals, even the perpetrator can walk right by the police officers. They can even tip their hat if they have on one and say, "Good evening, officer," because the immune system has been changed to specific. And that's the specific perpetrator that they are looking for has long braids, has tats all up and down their arms, has on a specific dress, and so they're not looking for them. They're not looking for them. They're looking for this one specific entity. And so when the immune system, when it has been altered, when its functionality has been changed, then we are not fully protected, because anything that is not that specific entity, then the immune system won't work against it. And so then what happens then? Now my immune system, it cannot identify, won't seek out to destroy cousins and nephews and brothers and all of that is in that same family. And so think about how many mutations. Think about if the immune system had been switched to a specific instead of non-specific, we never would have known that there were those that had come in contact with this coronavirus back in the 80s and now have an immunity, because they wouldn't have an immunity. Your natural immunity is the functionality is prevented. It is stopped when the immune system is changed to specific, because it is looking for a specific type and a specific entity. And so then that's how our immune system works. And so let's talk about the vaccine. The vaccine is it switches the immune system to specific, from non-specific to specific. So now let me put a disclaimer here. I am not telling you to take or not to take the virus. Neither one of them. Yes, ma'am. I see your question. I am not saying take or don't take the vaccine. I'm just telling you how it works. It switches the immune system to non-specific, which means that you're vulnerable for all of the mutations that come along. So if there are mutations, because your immune system has been switched to specific, you now need another virus that will cover that mutation, because your immune system is no longer non-specific. All right. How do we build the immune system? How do we build the immune system? Or how do we build that white blood cell? How do we build that white blood cell count? Number one, you're not going to like this. You're not going to like anything that I say from this point on. You need to stop cooking with the microwave. I have not had a microwave in my home probably for pretty close to 40 years. I've not had a microwave. And for the reason that was aforestated, the microwave cooking, it destroys the white blood cells and lowers the white blood cell count, making you vulnerable to any viruses, bacteria, fungus, anything. And there will be more. This virus is not it. It is not all. There will be more, which is why you need your immune system to be functioning as it should. Sugar products, you need to remove sugar products from your diet. Now, when I say sugar products, I mean processed sugar. I am not talking about your raw organic honey. I am not talking about your raw organic agave. I am not talking about your xylitol, which is the one thing that diabetics should, if they're going to use sugar, then xylitol should be it. You're definitely going to remove the sugar substitutes. The sugar substitutes, they are brain poisons. They attack the brain and they cause fissures and tears in the brain. Now, what does that have to do with the coronavirus? Remember, if you know anything about it and you know anything about those that have had it, you know they suffer from severe headaches. They suffer from severe headaches. They lose their sense of taste. Some of them lose their sense of taste and their sense of smell. All of that has to do with the brain. All of that has to do with the brain. And that means that your blood-brain barrier, that it was probably weak and was easily breached by the virus. And so another thing that you want to remove from your diet, along with the processed sugars and the enriched and the processed sugar products. So now you know I'm talking about ice cream, candy, chocolate, all of your favorite things. Yes, I've gone to meddling. And those things, you know, if you want to know about your white blood cell count and how you can boost it, then there are things that you have to remove from your diet. You have to be willing to give them up. And so your let's see, we have our sugars, we have our enriched flours, we have our microwave, and then we have our aspartame. I'm going to give you a few names, because, and you say, well, okay, what are those things? They sit on every table in the restaurant. They're in our cigarette holders in the car. We don't smoke anymore, but we do pack it with those sugar substitutes and other things that we that should not be there. And so those pink, blue, yellow packs, they have in them chemicals that cause cancer and chemicals that attack the brain. And because they attack the brain, they weaken that blood-brain barrier. They cause fissures and tears in the brain, and then the coronavirus comes along. And 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 I will tell you that you do not see. We're afraid of the virus. But what we should be afraid of are the side effects and all of those things that come after the virus, because we can be deemed free. You know, we can be deemed. They can test us. They can test us every week. But once you get this virus, and it doesn't have to be a very serious. It could be a mild. It could be a mild case, but it affects, if you lost that taste, if you lost that smell, if you had headaches, okay, that's brain damage. That is brain damage. And that's not going to go away with the virus when you are tested and you show up virus free. It is going to stay there because the brain and the nervous system, they have been damaged. And so the side effects, if you live through being infected, and you can, uh, and I'm telling you how you can do that by boosting your white blood cell count. You're saying, well, okay, but you're not telling us how to boost our white blood cell count. Yes, I am. I'm telling you to remove the things that destroy your white blood cells, and then to give your body what it needs to produce more. Now, I'm going to tell you one thing as church people, one thing that we have on our side, and that is fasting. That is fasting, especially water fasting. And then I know that there are some that's on medication and all of that. And we're getting ready to go on a fast. And so if you ever want to know what we're doing, how we're doing it, what you do on medication, that kind of thing, you can go to my website. And that website is MoPheth, MoPhethN as in Nancy, S as in Sam.com. And so then I'll have more information as we go through the fast on what you do. But the one thing about the fast, and I just think it is so awesome that God is absolutely so amazing, because I have been asked the question over and over again. Well, I've taken the vaccine, and again, I'm not saying take it or don't say it. I'm just telling you some questions that I've received. Well, I've taken the vaccine, and my immune system has been switched from non-specific to specific. What do I do? How can I switch it back to non-specific? Well, God in His awesome uh, wisdom, in His awesome wisdom and infinite mercy, He gave us fasting. On the third day of the fast, the immune system is reset. Fasting resets the immune system from from specific back to how God made it, back to non-specific. So from specific, which the vaccine switches it to, back to non-specific, which is what God made it to be. And so how does it do that? It does that on the fast. So the first 2 days of the fast, the body is getting rid of fat and it's getting
Thank you, Over. It looks like we're experiencing some technical difficulties with Dr. Shirley. Pastor, I'll pass it back to you until she rejoins.
Okay. So far we've been, man, that's been really powerful. I was kind of wondering what was going on. I thought it was my computer. I actually have my desktop on too, and it looks like the screen is frozen. I'm going to see just for a minute if we're going to be able to get her back on. But in the interim, I did at the onset of the program, I did acknowledge people who helped out today, but I want to specifically acknowledge uh, those who collaborated with social services for the health event today that was at Liberty Temple at 2233 West 79th Street. All of those people that and those organizations that and auxiliaries, the Westside Ministers Coalition, the Sisters Working It Out, the Liberty Nurses, the Cancer Care Ministry, the Deacons, the Turner family, security, especially with Elder Michael Brent, and all of the vendors that took part in this event. We did manage to escape the thunderstorms that was predicted for at least about 10 to 12 days. And as soon as we began to just stop what we were doing, then the sky turned dark. And so, God gave us, the grace to do what we needed to do. It was a really burning hot day. It was kind of ferocious out there. And, but it was a good day. And, so we've had two very powerful informational sessions with Dr. Towers, and then we had Miss Bristol from Addis Healthcare who gave us that infomercial, that brief one about Addis Home Healthcare. So if you're interested in signing up as a home healthcare worker, or if you're interested, if you're a senior yourself, or if you have seniors that need deep cleaning, or if you perhaps are a church leader and your church, things are opening up. I can tell that people are excited about, especially Chicago opening up because there's more traffic in the streets, and so people are just really just out there. And so, if you're interested in if you're opening up your church and you want it really deep cleaned and sprayed down, everything disinfected, then you should contact Miss Brister. I'm not sure, Michael, if we're going to be able to get Dr. Hill back on. So it is about 5:48. Are you able to hear me, Michael?
Yes, I am.
Okay. Are we able to get Dr. Hill back on?
Not at this time.
I'm sorry.
Not at this time.
Okay. Okay. So at this time, we're going to conclude with our presentations, and we would like to thank everyone who participated, Dr. Towers, Ms. Bristol, and Dr. Hill. And unfortunately, we lost Dr. Hill at the very end because I think there were people who wanted to ask some questions. But you can always, if you have some additional questions, you can always contact Dr. Hill. You could email her. She does have a Facebook page, and yes, that's the Facebook page is www.mopeths.com. So you can contact her that way, and you can ask her questions. And we're going to conclude with our broadcast, and on behalf of Apostle
Oh,
Shirley Lathan and Liberty Temple Full Gospel Church and World Outreach Ministries, we're going to. Oh, is Dr. Hills back? Oh, there you go. It's like, man, you kind of popped out and then thought, okay, we got about maybe 10 minutes. Okay. Thank you for coming back on. I was like, man, we lost our friend. It's like, where'd she go? You know,
I, the storm. My poor little internet. It just died.
kind of knocked it out. I did have a question for you
Yes,
before
sir.
you sign off. In reference to, you and I talked about this in reference to supplements. And we talked about boosting your immune system. And I want to say, if we talked about flowing into this earlier, man, you were long gone. I was just kind of just sitting back and just, just enjoying myself. But in terms of supplementation, there's a lot of, there were a lot of supplements, especially like vitamin C supplements, like when the pandemic first hit last year, last March, and
Yeah.
you couldn't really keep this stuff stocked up. People were buying all of these supplements like from Walgreens. I had some of that stuff, that vitamin C stuff that you told me was nothing but candy. It was kind of junk, and so it told me I need to get some real vitamin C supplementation. So, what's the best kind of supplementation should we use? Those kind of, and are there specific supplements? We've heard about certain ones, vitamins like vitamin C, vitamin E, and people who have been susceptible to the coronavirus is been said by researchers they normally have abnormally low vitamin D levels. So how should we supplement? What's the best way?
Well, these I'm going to tell you the supplementation that I give for that I recommend to people that have had and are that may have or may contract. I recommend vitamin C complex powder and vitamin C complex powder. I recommend that because vitamin C, our body does not make it, but our body needs it. It needs it because it protects the cell membrane. The first thing that the virus has to do is break into the cell membrane, and then the next thing the virus works on is getting into that DNA, replacing the bases in the DNA and inserting its RNA. Well, vitamin C protects the DNA, and it repairs the DNA if if the DNA has been attacked. And so um, vitamin C with, I'm sorry, let me see what we're doing here. Vitamin C with I'm on my phone, you all. So I hope you all can see me. I hope you all can see me because I can't see me. And so vitamin C. Am am I visible, sir?
Yes, yes, you are.
Okay.
You look
And so
beautiful.
vitamin thank you. One of those things, vitamin C complex powder. Now, notice I said complex powder. Vitamin C is a complex. It is a complex like vitamin B. And if you get ascorbic acid, citric acid, any of those things, then it's just junk. You need vitamin C complex powder. And so then, and there are just a few that I recommend. And again, you can find that on the website. I recommend spirulina. And a lot of people ask me, well, why do you recommend spirulina and you don't recommend, oh my goodness. There's something that's very, very popular now. I can't think of the name of it because it's not something that I say often. But I recommend spirulina over any other green algae because, well, number one, I've used it for probably and recommended it probably for uh, 40 years now. And it does what it is far above all of the other. Now they're all good. They're all the green algae. They're all good. They all do what they do in their own perspective places, but or respective places. But spirulina, the spirulina is the center ion in spirulina is almost identical to the center ion in your blood. And so then um, you want that blood, you want those blood cells in that bone marrow to be produced properly. And that is where your white blood cells are produced. They're produced in the bone marrow. And so that spirulina, it builds that bone marrow, and it builds that the blood. Yes, sir. Did you have a question?
Yeah, I do have a question. Now, I have to ask you how Leslie Stahl asked President Trump. Are you ready for a hard question? Okay. You remember that interview? So, this is a question concerning vegetarians. Quite often, many vegetarians, not all of them, but a number of them, sometimes they are sometimes undernourished. So how can they, how can they find a equitable balance there? Because sometimes they don't consume enough calories and consume enough, even though there might be good things that they're eating. How can they find that balance?
Well, they have to eat enough calories. They're eating the right foods. If they're eating fruits and raw fruits and vegetables, as vegetarians should be, and not just not eating meat and overloading on carbohydrates and in enriched flour products, which is what's happening with the newer vegetarians. Now, vegetarianism, that is the best thing. The United States of America has been doing a study since 1958 on the Seventh-day Adventists because they have been deemed the healthiest people on the planet since 1958. And they have studied them, gone from one study to another study to another study, and they're still conducting studies. Now they're doing longevity studies. Why? I used to have a chain of beauty salons, and quite a few of my clients were Seventh-day Adventists. And I asked, how in the world is it that an entire organization is the healthiest people on the planet? And what she said was, we have a farm. We have a farm in every region of the United States of America, and our people get their food from that organic farm. Everything that we need, that the body needs, we can get it in fruits and vegetables, raw fruits and vegetables, and that includes protein because the body needs amino acids, not protein. So if they're not eating enough, first they have to be eating the right kinds of food, not just not eating meat. Secondly, they need to be eating enough of that food. They have to eat enough of that food in order for their body to be able to function properly, because it needs the right amount of material and the right kind of material. Did that
Okay.
answer your
We have
question?
time for one more question. Yes, it
Okay.
does. One more question. Um, if you sometimes if you watch the news reports, you've probably been seeing well, most people probably been seeing Senator Rand Paul, who actually is a medical doctor. He's been kind of really sticking it to Dr. Fauci about the use of masks, and so Senator Paul is saying that there's no evidence that the masks provide any kind of protection. What's your opinion on that? And this is railing Dr. Fauci because he's saying that Dr. Fauci keeps flip flopping on the issue. So should, in lieu of all of this and what's been said today and what's been happening, should we still wear masks?
Well, let me say it this way. Long when we were at our highest loss of life, there were other nations in America, not in America, there were other nations around the world that had bouts with the coronavirus and got rid of it in as little as 3 months. And so we have yellow zones, which were the ones that got rid of this virus almost immediately. We had the orange zone, which it was a little bit rougher on them. And then we had the red zone, which America, Canada, England, and France was that red zone, and we're still that red zone. And what we were never told is that there were other nations that got rid of this coronavirus in 2 or 3 months. They got rid of it in 6 weeks. They got rid of it. I mean, you almost Haiti got rid of it. There are places, Nigeria and Africa. There are nations in Europe and all around there. There are places that got rid of this virus. How did they get rid of it? They quarantined. They actually, one sister, I think it was in Australia, I may be wrong, but that girl she was on it. If you came out of your house to go anywhere to the other than to the store or to the pharmacy to get medication and that, you got a free trip to jail, because they were not playing. You were to quarantine yourself. When you came out, you were to wear your mask and you were to social distance, and they were not playing. And that's how they got, and that was long before. That's when we first started talking about the vaccine. That was long before the vaccine. People were getting rid of. You listen, this is an airborne, this virus is airborne. If you don't wear your mask, I walked up the stairs. I walked up the stairs of so I took the transportation and I walked up the stairs. When I got to the top of the stairs, there was a young man that was outside the door. He was hawking and spitting on the sidewalk. I had my mask on. There were young men that were behind me that was not aware. They didn't see what I saw, that he was honking and spitting on the sidewalk outside the door. They had to walk through this, whatever he had, for whatever reason he was honking and spitting. I walked through it, but I had a mask on. They walked through and they did not have a mask on. Where was their protection? It was airborne. He had released whatever was in him. He had released it into the atmosphere. It was lingering outside the door where they had to walk right through. I recommend that you wear your mask. I never wavered on that. And I say until people are no longer dying from this, wear your mask, because we have too many ways for you that mask will protect you. So that's how I feel about it.
Amen. Well, we're out of time, and Dr. Hill, this was certainly a treat. And We're getting ready to sign off. So I would just like to say on behalf of the Apostolic Leadership of Liberty Temple, Apostle Shirley Lathan, Apostle Darwin Turner, Apostle Early James, the Liberty International Network, we are signing out right now. And thank you, all of you who have tuned in, and those of you who will see this later, or if you came on late, you can go back and watch this broadcast probably in about maybe 15 to 20 minutes. And so, and we also, I'd like to thank Michael Dorsey, our internet technician, who provided great service for us this evening. And so we're signing out. We're out of time. Hey, Prophet Purpose. Good night and God bless you. And we will see you next time. Bye bye.